Welcome everyone to Dr. Nguyen's YouTube channel, where we delve into health topics that matter to you. Today, we're addressing a prevalent health issue, hypertension. Hypertension, often referred to as high blood pressure, is a condition that affects a significant portion of the global population. It's a silent adversary, often showing no symptoms until it's too late, leading to severe health complications. Its prevalence is a testament to our modern lifestyle, filled with stress, unhealthy diet habits, and lack of physical activity. Understanding hypertension is not just for those who are at risk or have already been diagnosed. It's crucial for everyone. Why, you may ask? Because the key to dealing with hypertension lies in prevention and early detection. Knowing what it is, how it develops, and how it can be controlled can make a world of difference. By the end of this video, you'll have a comprehensive understanding of hypertension, from its causes to its prevention. Before we dive into the details, let's start with a general overview of hypertension. Hypertension, often referred to as high blood pressure, is a common health condition where the force of blood against your artery walls is consistently too high. Think of it like too much pressure in a garden hose, eventually causing damage to the hose itself. In our bodies, this pressure can damage arteries and lead to severe health problems like heart disease and stroke. It's a sneaky condition, often showing no symptoms while it silently wreaks havoc on our bodies. If left untreated over time, hypertension can lead to long-term effects such as heart and kidney disease, stroke, and even vision loss. Hence, it's often termed as a silent killer. It's crucial to understand that hypertension is not just a condition, but a persistent threat to our overall health. Having understood what hypertension is, let's now look at what causes this condition. We often wonder, what causes hypertension? Is it our lifestyle, genetics, or something else? Let's dive into the various causes that contribute to this condition. Firstly, lifestyle factors play a significant role. An unhealthy diet, particularly one high in salt, lack of physical activity, excessive alcohol, and tobacco use, can all lead to hypertension. Then there's your genetic makeup. If your parents or close relatives have hypertension, you are more likely to develop it too. It's like an unwelcome family heirloom that no one really wants. Certain health conditions can also cause hypertension. Kidney diseases, hormonal disorders, and conditions like diabetes can elevate your blood pressure levels. Lastly, age and race also play a part. Hypertension is more common in people over the age of 60 and in African American populations. Understanding these causes can help us make changes to our lifestyle and manage our health better. Now that we know the causes, what are the symptoms to look out for? Identifying hypertension early can help prevent complications. But what symptoms should you look for? Hypertension, also known as high blood pressure, is often referred to as a silent killer due to its lack of noticeable symptoms. Many people with hypertension may not even realize they have it until they undergo a routine health checkup. That's why regular checkups are crucial. However, in some cases, hypertension may present symptoms such as headaches, shortness of breath, or nosebleeds. But these usually occur when blood pressure spikes to dangerously high levels, or when hypertension has been present for a long time. It's important to note that these symptoms can be easily mistaken for less serious conditions, making hypertension a tricky condition to spot based on symptoms alone. So how is hypertension diagnosed then? Healthcare professionals usually diagnose hypertension using a device called a sphygmomanometer, which measures your blood pressure. This is typically done in a calm environment, as factors like stress can temporarily increase blood pressure. The reading is expressed in two numbers, with the top number indicating your systolic pressure, and the bottom number representing your diastolic pressure. Hypertension is typically diagnosed when a person has a sustained blood pressure reading of 140 over 90 millimeters of mercury, mmHg, on multiple occasions. Remember, early detection is key in managing hypertension effectively and preventing further complications, such as heart disease and stroke. With the symptoms in mind, let's now explore the possible treatments for hypertension. Once diagnosed with hypertension, the next step is treatment. But what does this entail? Well, the treatment of hypertension is primarily focused on reducing the high blood pressure and addressing the underlying causes or factors contributing to the condition. One of the most common methods of treatment is through medications. There are several types of medications used, each working in a different way to help lower blood pressure. These include diuretics, which help your kidneys eliminate sodium and water from the body. Beta blockers, which reduce the workload on your heart and open your blood vessels, causing the heart to beat slower and with less force. And ACE inhibitors, which help relax blood vessels by blocking the formation of a natural chemical that narrows blood vessels. In addition to medication, some individuals might require surgical procedures. For instance, renal denervation is a procedure that uses radiofrequency energy to treat resistant hypertension. It's important to note that while these treatments are effective, they are not one-size-fits-all solutions. Each individual's treatment plan will be tailored to their specific needs and condition. It's also crucial to have regular checkups with your healthcare provider to monitor your condition and adjust your treatment plan as necessary. But remember, treatment doesn't end with medication and surgeries. Besides medical treatment, there are non-medical approaches that can help manage hypertension. Let's discuss these next. Non-medical treatments can play a significant role in managing hypertension. How can we incorporate these into our daily lives? Let's delve into some of the lifestyle changes and natural remedies that can help manage hypertension. Making healthier food choices, such as incorporating fresh fruits, vegetables, and lean proteins, while reducing sodium intake, can have a significant impact on blood pressure levels. Regular physical activity is another cornerstone of non-medical treatment. Whether it's brisk walking, cycling, or a quick swim, aim for at least 30 minutes of moderate intensity exercise most days of the week. Don't forget the importance of maintaining a healthy weight. Even losing a small amount of weight if you're overweight can help reduce hypertension. Reducing stress through mindfulness practices like meditation or yoga, limiting alcohol, and quitting smoking are also beneficial. Remember, these lifestyle changes should complement, not replace, prescribed medical treatments. While managing hypertension is crucial, it's equally important to understand the complications if left untreated. Scene script. Unchecked hypertension can lead to serious complications. However, these can be prevented. Hypertension, often known as the silent killer, doesn't usually show symptoms until it's too late. If left untreated, it can lead to severe health issues such as heart attack, stroke, kidney disease, and even heart failure. It's a stark reminder of how important it is to manage this condition effectively. Prevention and management of hypertension revolve around a healthy lifestyle. This includes maintaining a balanced diet rich in fruits, vegetables, and lean proteins, while limiting sodium and alcohol intake. Regular exercise also plays a critical role. Aim for at least 30 minutes of moderate intensity physical activity most days of the week. Monitoring your blood pressure regularly is another preventive measure. Regular checkups can help identify any potential issues early on. If you have a family history of hypertension or other risk factors, your healthcare provider may recommend more frequent monitoring. Medication may also be necessary for some individuals. However, it's crucial to remember that these are not a substitute for a healthy lifestyle. They work best in conjunction with a balanced diet, regular exercise, and stress management techniques. Stress management is another crucial aspect of prevention. Chronic stress can contribute to hypertension, so finding ways to manage stress effectively can go a long way in maintaining healthy blood pressure levels. With the right knowledge and steps, hypertension can be managed effectively. Let's not allow this silent killer to go unchecked. Stay informed, stay healthy, and take control of your health. As we wrap up, let's summarize the key points we've covered today. We dove into the world of hypertension, exploring its causes and symptoms, and how it's diagnosed. We looked at both medical and non-medical treatments, and the complications that can arise if it's not managed properly. Lastly, we discussed the importance of prevention, because knowledge is the first step towards a healthier future. Thank you for joining us today on Dr. Nguyen's YouTube channel. Stay informed, stay healthy,